And it is currently 62 here at 95.7. Joining me now, Dr. Ryan Jennings, Chief Medical Officer at HSHS St. Anthony Hospital. Good morning, Ryan. How you doing?
Oh, good morning, Gail. I'm good. How are you?
Oh, I'm great. I'm doing just great. Loving this weather.
No kidding. Boy, what a gorgeous day.
It is. It's absolutely beautiful, and I think we're all ready for some good weather.
That is the truth. It's get outside. We know we can still get outside, and we're really tired of the indoors.
That's right. Go have a picnic in your backyard or your front yard or your side yard, whichever yard you want to use. Oh my gosh. So, how are things going at the hospital, Ryan?
Well, we continue to have really good news. Obviously we've got some concern that still around the outbreak in Jasper County, and unfortunately they did have an additional patient that passed away, and certainly our thoughts and prayers continue to be with those families and those healthcare workers that are in a difficult time. But overall, the number of total cases kind of plateaued at this point. They're not seeing large additional numbers, and we've not seen hospitalizations, which is great news as well. So, hopefully that's an impact of all the distancing that we're doing, all the precautions that people have put in place, and will continue to, even though there's a prevalence within the region, not see it spread dramatically within the community itself. So. The story's still a little bit to be told there because it's still early, in the exposure period of, kind of when this first came to light. So it, there is still obvious concern, but the good news is at this point, hopefully we're going to see that kind of go and through its own process and then not spread dramatically within the community itself. So that's exciting. I mean, it's unfortunate, but it's good news.
Absolutely, yeah. I mean that any time that the numbers can stay the same or not dramatically increase, that's what we want to see. We want to see them go down.
Yeah, boy, don't we? Yeah.
Right, yeah. But as long as, at least we're not, having a surge and a blowout here.
No, you're spot on. And then the governor's announcements last week around continuing with the stay-at-home order, I think is a great idea again to help continue to control the spread. But they did also open some things up, specifically related to the hospital. We were given some guidance on now how we could begin to potentially resume doing some elective surgeries and those types of things, because some folks have been out there now for more than 30 days of what was originally supposed to be, a delay, and now what was elective is becoming progressively more urgent. And so they did provide some direction and guidelines to the Illinois Department of Public Health for us to resume potentially doing some surgeries after May 11th. And so, our time right now is being spent in firming up those processes to make sure that when we do resume, that we're able to do so safely. And few things that'll be different for folks than normal, one of which is that they do require that patients prior to surgery be tested for COVID, and then within 72 hours of the planned procedure, and then isolate themselves. So basically get your test, self-quarantine up until the day of surgery, so that we'll know that we're able to proceed safely with bringing you into the facility and getting those procedures done. So a little bit of a good sign that some return to normalcy, and certainly the ability to care for some of those things that have been delayed, appropriately so initially, but what once was elective slowly but surely becomes, it's got to happen,
Right.
And so we're anxiously awaiting the ability to do that, but in the meantime, putting into place those processes to make sure that when we do it, that we'll be safe for both the colleagues as well as the patients themselves.
So the guidelines, with the numbers, as we said, there's not the surge, there's not a big blowout. So the guidelines are working.
I think so. I think were it not for we've seen it. We know when you have close contact and the nursing home is a great example of that.
Mm-hmm.
We know it spreads very, very quickly throughout. So, the fact that the distancing in the community has been effective in reducing the spread of the disease is a blessing, and has given us time to then, on the backside, for people a lot smarter than me to be working out treatments, be working out vaccinations, be working on all of those things, so that hopefully over the next several months we'll have a true handle on this thing that will not just involve simply trying to stay away from each other. We'll have some real options.
So, speaking of vaccines, what is the news in the medical world regarding that? Do they have hope that they will have a vaccine developed soon, or is there much progress being made along those lines?
There's definitely progress, and a couple of them have actually entered what we call kind of the phase 1 trials, where they've gone ahead and administered the vaccine to initial volunteers. But the human body is kind of funny. When you do that, then you have to wait on the body to react to the vaccine, and then months later measure the antibody levels. We talk about the testing stuff and the two different kinds of testing. One is the nose swab, where you're testing to see if you have the virus. The other is that blood test to see if you've had the virus and now you have immunity. Well, that takes several weeks, 6, 8, 10, 12 weeks after you've had the disease before you see high levels of the antibodies within the bloodstream. With the vaccine, it's very much the same way. So although they've initially administered vaccine, now we're in that waiting period of seeing how the body responds to that vaccine, as far as do they get sick from it itself, which is always a possibility. Anything that revs up your immune system at a minimum can kind of make you achy and not feel good, kind of like after a flu shot. Even though the flu shot won't give you the flu, it's a killed vaccine. Similarly to this, it's a killed vaccine, but it likely can make you ache and just not feel good, run a little fever, that type of thing. And then several weeks later, be able to measure that immune response, because not all vaccines are effective as far as triggering an immune response, and so it'll be very important to complete those studies before being able to roll this vaccine out much more broadly. So we're probably more or less a year before we're going to be truly having any type of access to a large scale vaccination. So more to come, of course, and similar to some of the medications that they're currently taking a look at and doing some actual research trials on. Up front there was all the excitement around hydroxychloroquine, but then once we actually got into the United States and really started studying it, we found that there was significant harm from that medication for a large part of the population. And so what once was touted as the great answer, once you really got the science to it, it didn't hold up, and so we want to make sure we get the science behind this, and in the meantime, doing those self-protective measures with the hand washing, and of course, as of May 1st, the masking in public places, again with the idea of controlling the spread. That mask is not going to directly protect you from someone else, but if you happen to be carrying it, if you sneeze, cough, etc., then that mask will help to prevent that from spreading onto surfaces and to other people. So we're all looking forward to our tan lines around our mask.
I thought about that the other day. I thought I can see the memes on Facebook now, with the tan lines, and normally it's with the sunglasses, but it's going to be just the opposite now. We're all going to have very white lower faces.
Yeah. It's definitely going to be a different look to summer this year. So.
Yeah. My hands have been washed so much now that the palms of them kind of look like the belly of a fish.
I'm sure.
Oh my gosh! We wash. I don't know how many times a day. I've lost count. I quit counting.
But that's the right thing to do, and then that's what's going to keep us and keep it contained. And fortunately, I think we've seen that impact. But it's so tempting to say, all right, let's get back to life ASAP. And I think we're starting to see some elements of that. And desperately needed for businesses and employees and everybody else to get back to work as soon as possible, but have to phase that in a way that we accomplish that safely.
Right, because we don't want to have to start this all over again. If opening things up too broadly, too quickly, and people letting their guard down, and then all of a sudden the numbers go up, and it's like all of this has been for nothing.
Exactly. That's certainly not what we want. After going through all this, let's not screw it up now.
Exactly. You said that so much better than I did, but that's exactly what I was trying to say. Yeah. So, well, Ryan, I just appreciate so much you taking the time to update us and let us know what's going on and, where things kind of stand. And it's good that, the numbers are staying the same. We're so glad to hear that. They are, I think they are, with the exception, as we said, of Jasper County. I think the surrounding counties, all of their numbers are pretty much remaining the same, which is very good news. So.
It is great news, and maybe again we're starting to have real conversations about getting back to some level of normalcy, and we're all excited about that. But when we do that, we want to make sure the community and the hospital are a safe place for everybody involved.
Absolutely. Well, you have a wonderful day, and thank you so much, Ryan.
My pleasure. Get some sunshine, folks.
Yeah.
Thanks
Work on
to
those tan
WCRC.
lines. Okay, bye-bye.
Bye-bye.
Okay, bye-bye.